Finasteride is widely considered the king of hair loss, and for good reason. Up to 85% of users will stabilize their hair loss, and many of these will also get some regrowth. Now, having said that, the typical regrowth you can expect is mild. It's often barely visible to the naked eye. It's also possible that you'll eventually develop some degree of resistance to finasteride over the years, and its efficacy will start to decline. For this reason, unless you catch your hair loss at a very early stage, you're probably not going to be content with the results. You see, finasteride does one thing and one thing only. It blocks DHT. And we know today of various mechanisms of action that lead to regrowth independent of DHT, meaning you're going to want to add these mechanisms to your finasteride stack to max out your gains. Now, the most common second treatment guys generally choose is topical minoxidil. This is a hair growth stimulant that works independently of DHT, and it'll grow hair anywhere you apply it on the body, including the scalp. Add minoxidil to your finasteride, and the 85% response rate we mentioned earlier shoots up to around 95%. In other words, it's extremely unlikely you're not going to get results from this combo, especially if you're young and with less advanced hair loss. And these results will typically be far better than finasteride monotherapy. Now, add a weekly microneedling session on top of that, in other words, finasteride plus minoxidil plus microneedling, and you're looking at a more or less 100% response rate. Adding regular microneedling sessions to daily minoxidil improves its efficiency in two ways. Firstly, by increasing its absorption, and secondly, by stimulating the scalp skin to produce growth factors which rejuvenate the follicles. Now, results will vary depending on the factors we touched above, namely the age and the degree of the hair loss. But with a stack like this, extensive regrowth is a very realistic possibility. Now, a downside to all this is that by stacking your daily meds, you're increasing your chances of side effects. An alternative to a daily second medication is an intervention like Botox injections to the scalp. This is something you'll generally have to get done at a doctor's office every 3 or so months. Now, the injections will loosen the muscles that surround the scalp, allowing it to relax. This is important because balding scalps are chronically tight on account of the tension they receive from the surrounding muscles. And we have strong reason to suspect that this chronic tightness, in turn, triggers various long-term tissue changes to your scalp. These include inflammation and the buildup of microscopic scar tissue, so-called fibrosis. The tightness is also very likely behind the well-documented reduction in blood flow, likely through constricting of the vessels that pass from the periphery to the various parts of the scalp. Now, balding scalps very obviously exhibit lower blood flow than scalps with hair. Minoxidil helps relieve this blood flow deficit, but the effects only last for up to 2 hours after application, whereas Botox offers relief that lasts weeks or months at a time. The professor who first studied the use of Botox for hair growth put it this way, quote, "The scalp behaves like a drum skin with tensioning muscles around the periphery. These muscle groups can create a tight scalp when chronically active. Because the blood supply to the scalp enters through the periphery, a reduction in blood flow would be most apparent at the distal ends of the vessels, specifically the vertex and frontal peaks. Conceptually, Botox loosens the scalp, reducing pressure on the perforating vasculature, thereby increasing blood flow and oxygen concentration." Now, Botox injections on their own give on average roughly 20% better regrowth than finasteride, and combining the two adds another 10% efficacy on top of that. The major downside to Botox is the cost, which can add up to several $1,000s a year, which makes it a complete non-starter for most of us. So what other options are there to boost the results from finasteride? Well, one option that's now gaining massive popularity is manual scalp massages that improve the condition of the scalp. Just quickly, imagine this. When someone gets a hair transplant, they take healthy hairs from the back of the head and transplant them to the front of the head. Over time, though, without the use of finasteride, those transplanted hairs start thinning. We see this all the time with transplant patients who do not take finasteride. Those hairs added to the front start thinning, whilst hairs at the back remain perfectly healthy and thick. Although it can take even up to 10 years for this to happen, it shows that scalp location is vitally important. This is because the scalp at the front starts to build up fibrotic tissues which reduce the growth space and blood supply of the hair follicle. But this doesn't happen at the back of the scalp, which is why men keep this ring of hair late into old age. DHT plays a key role in this fibrotic process, which is why blocking DHT with finasteride stops hair loss. So to get better results from finasteride, you need to try to remodel the scalp tissues at the front and reduce the fibrosis. tissues. Scalp massages can help to remodel the scalp tissues and reduce fibrosis, especially when combined with DHT blockers. Currently, the most efficient way to do scalp massages is with a device called a Growband. This massages the entire scalp in a fully automated and hands-free way. Simply place the device on your head, adjust the size to fit, and turn on the grow box. You can completely control the cycle so you get the right power of the massage. The lifting motion pinches and squeezes the top of the scalp, helping to remodel the fibrotic tissue and improve microvascular circulation. Studies have shown that tension levels in the scalp correlate almost exactly with the pattern found in male pattern baldness, and the Growband helps to decrease this all over the scalp. Users are now getting great results with and without DHT blockers. The Growband is only available at Hairguard.com, so head over to learn more. So guys, I want to know, have you gotten satisfactory results from Finasteride? Did you have any side effects? Have you tried combination treatments? And have scalp massages helped improve your hair growth? Let me know in the comments. Also, make sure to give us a like and subscribe, and I'll catch you next time. Take care.
More hair, naturally. Hairguard.